When you should consider a knee replacement surgery. If you are suffering from knee pain and your symptoms are not relieved by physiotherapy, exercises, weight loss, and also after taking medicines for a considerable period of time, your doctor may advise you a knee replacement surgery. Especially in spite of taking medicines, if you have pain in daily living activities, you are not able to take care of yourself, your doctor may advise you a total knee replacement surgery or a unicompartmental knee replacement surgery. What are the steps involved in a knee replacement surgery? There are four basic questions that need to be answered before any patient undergoes a knee replacement surgery. Number one question is, do you need a knee replacement surgery? So for that, a doctor will examine you and also see your x-rays. Mostly, knee replacement surgery is offered to a patient who has symptoms as well as bone-on-bone arthritis on his x-rays. The second question that needs to be answered is, are you ready for a knee replacement surgery? Unless a patient consents for a knee replacement surgery, doctor cannot proceed and perform a knee replacement surgery. The third question, important question that needs to be asked is the patient fit to undergo a knee replacement surgery? All doctors will advise you to undergo pre-operative checkups which ascertains whether this surgery is risk-free or whether you need some medical preconditioning before surgery. And then the next question is, when to do a knee replacement surgery? So, if the patient needs a knee replacement surgery, if he is willing for a surgery, and if he is fit to undergo knee replacement surgery, your doctor will give you a date for your knee replacement surgery.